heart failure, dilated cardiomyopathy, and coronary artery disease. According to the Barnes-Jewish Hospital Transplant Center website, these are just few of many fatal heart conditions. Thankfully, over time, many medical milestones have been reached. But who is the man that made this possible? Dr. Christiaan Barnard. Today, we will be walking through the journey of Dr. Christiaan Barnard, going over the first heart transplant, and I will be teaching you the process of removal for the first heart transplant. In 1922, Dr. Christiaan Barnard was born. It seems like a long time ago since the first heart transplant, or since his medical milestone was made, but actually he died in 2001, so that was just a couple years before most of us were born. The South African medical legend was one of the most recent people to make a medical milestone. Most recent people to make a medical milestone. He was actually a genius his whole entire career, even from residency. He was the first to demonstrate intestinal atresia, which is actually a congenital gap in the small intestine, and it's caused by an insufficient blood supply to the fetus. Because of him, a procedure was developed to fix this fatal defect. After finishing his doctoral studies as a cardiothoracic surgeon, he returned to South Africa and introduced open heart surgery to his country. Then he started experimental procedures on dogs, where he did procedures to make designs for new heart valves. Then he did a 3-month sabbatical for immunosuppressive therapy on kidney transplant patients. With the idea of a human-to-human heart transplant in mind, he did lab work and simulations with Richard Lower for experimental heart transplants. Then after that, but because of religious beliefs and the fact that the human heart is arguably the most important organ in the body, the human-to-human heart transplant had never ever been done before. Now that you know a little bit about the man that made this possible, let's travel back to December 3rd, 1967. We have Denise Derval, who is a 25-year-old female who was declared brain dead due to a traffic accident. We have our patient, Mr. Louis Washkansky. He has ischemic heart disease, and according to heart.org, it is an incurable heart disease that is fatal. It is a condition of narrow heart arteries that restricts the blood flow and oxygen that can reach the heart. But, unless a heart transplant was possible. So now is the time a medical advancement needs to be made. Christiaan Barnard has been looking for this moment his whole entire career. So he put together a surgical team and proceeded with the transplant into Mr. Washkansky. Fortunately, the transplant was successful. But unfortunately for Mr. Washkansky, he did die 18 days later due to contracting double pneumonia. The reason this was contracted was because he was given so many medications to prevent organ failure. This was a risk because his body could have seen his new heart as foreign protein. Foreign protein because the reason he could have seen it as foreign protein, and instead of helping, the medications actually tore down his immune system and allowed him to contract the double pneumonia, which killed him. But by knowing this, they were able to make adjustments, and by the late 1970s, Barnard's patients were able to live 5 years post-operation. But you're probably wondering how human-human heart transplants are possible. Well, it's a very lengthy and complicated process, and I can't go through it all, but I can walk you through the process of removal, according to the National Institutes of Health. And this is the process that Christiaan Barnard used. So, the night of December 3rd, 1967, Christiaan Barnard concluded the brain death of his donor. And it's very important to specifically conclude brain death of the donor and make sure that they have viable organs. He then waited for the donor's heart to stop beating and disconnected them from the ventilator, and waited for the EKG to show no cardiac output. The EKG is a test to measure the heart activity. He then split open the chest by splitting the sternum, and then that demonstrated that the heart was blue and not beating. After that, he connected the heart to a heart and lungs machine where it circulated cold, oxygenated blood. The purpose of this was to reduce the metabolism of the heart while it is in the process of transplantation. After this, the heart was rapidly cooled to prevent its ischemic injury. And then next, the heart was excised in a way to connect to the heart and lungs machine while it was able to be carried into the transplant receiver's room. It's very important that the heart was protected while it was carried into the next room because of preventing ischemic injury. After that was the reattachment, which is a very lengthy procedure that I will not be explaining today. But after the attachment is around-the-clock post-operative care and medication. Bernard's method of removal is not used today, but it did change the way we think about heart health and common medication therapies today. So because of him, many millions of lives were saved. Today, we went over the background of Christiaan Barnard and the genius he is, the first heart transplantation, and the process of removal of heart transplantation. I hope today you feel inspired and maybe inspired enough to make your own medical advancements someday, or even any advancements at all. You could too save billions of lives and even be the next Christiaan Barnard.